Hello, everybody. This is Gary. Today is August 25th, 2021. It's 6:27 p.m. Eastern Standard Time in the United States in Rochester, New York. And I just wanted to do a quick video on the difference of schizoaffective disorder and schizophrenia. When I do my videos, I usually entitle them with the word schizophrenia. Technically speaking, I have schizoaffective disorder. That's my diagnosis. The reason I use the word schizophrenia is because the Diagnostic and Statistical Manual number 5 of the American Psychiatric Association sees schizophrenia as a spectrum, the same way autism is on a spectrum. It starts with a certain set of mild forms of autism on one end of the spectrum and then goes all the way over to the more severe side of the spectrum and everything in between. Schizophrenia is like that. The Diagnostic and Statistical Manual no longer classifies specific forms of schizophrenia the way it used to, like paranoid schizophrenia, catatonic schizophrenia, or hebephrenic schizophrenia. At least I think that's how it's pronounced. Instead, schizophrenia is seen as a spectrum of different symptoms and disorders that have or might have different names, but still fall on the schizophrenia spectrum. And schizoaffective disorder falls on the schizophrenia spectrum. So when I use the term schizophrenia to describe my videos and to describe myself, I'm using the word schizophrenia in its broadest sense. I am diagnosed as schizoaffective, which falls within the schizophrenia spectrum. Specifically, schizoaffective disorder is sort of like a combination of psychotic disorders associated with schizophrenia, and in my case, bipolar disorder, which is a mood disorder. And it's a combination of those two sets of symptoms. In my case, the psychotic symptoms include hallucinations, auditory hallucinations. I don't have visual hallucinations. The only time I've ever had visual hallucinations is under the influence of drugs. I generally have never experienced that in my everyday life, although I do hear voices. And generally those voices tell me that people are following me, plotting against me, that kind of thing. They never tell me to do anything to harm myself or harm others, like some people with psychosis have. The word psychosis, by the way, is a broad term. It can apply to many different disorders. It simply means breaking away from reality and living in a world of false beliefs and false perceptions, and generally not understanding reality as it really is. And this includes hallucinations and delusions. And that's another aspect of psychosis and schizophrenia I have, is delusions. Believing people are following me or trying to hurt me or are plotting against me in some fashion. That can take many forms in my case. I could believe anybody's plotting against me. People who I'm walking by out on the streets, I think they're following me when they're not following me. That's not to say I've never been hurt. I've been mugged, I've been attacked before. But that's not really what I'm talking about. I'm just talking about in general, believing people are just random strangers, believing they're following me or they're part of a conspiracy against me and there's an organized group following me. I used to believe that I was being what's called gang stalked. I'm not going to get into that right now. If you want to know what gang stalking is, Google it, or better yet, go on YouTube and search for it. You'll find countless videos on trying to explain what gang stalking is. I'm not going to get into that right now. But back to schizoaffective disorder. Schizoaffective disorder has psychotic symptoms that are a part of schizophrenia mixed in with the mood disorder, bipolar disorder. Bipolar disorder can take several different forms, but it generally means mood swings between euphoria, ecstasy, and severe depression, and cycling between the two. So I have psychotic symptoms like hearing voices, delusions, hallucinations, what's called negative um, symptoms like flat emotional affect, no drive to do anything, lack of interest in everyday things, lack of motivation, um, and some uh, positive symptoms. Positive, not in the good sense, but positive in the sense that there are active symptoms like the auditory hallucinations and the delusions. Those are called positive symptoms of schizophrenia, um, because they add something to the personality that simply isn't normally there. And negative symptoms take something away from the personality, like motivation, being interested in everyday things like having friends, hobbies, a job, um, politics, religion, just having different interests and things are absent and negative symptoms. They take something away from personality. And I have some of all of these mixed in together. So that's why I use the term schizophrenia when I describe myself, because I believe my psychotic symptoms are more prominent than the bipolar aspects of my disorder. I definitely have mood swings. I definitely need to take a mood stabilizer. That's why I take Seroquel. And interestingly enough, Seroquel is also an antipsychotic which helps control my psychotic symptoms. Um, so, schizoaffective disorder is a mixture of psychotic symptoms and mood disorder symptoms. Bipolar disorder, separate from any other psychotic symptoms, would just be typical bipolar disorder. It wouldn't necessarily have hallucinations, um, severe psychotic delusions, the auditory hallucinations, the visual hallucinations, the negative symptoms or the positive symptoms of psychosis. Um, so I just wanted to clarify why I use the term schizophrenia, because I believe my psychotic symptoms of schizophrenia are much more prominent than my bipolar symptoms. They're both there, but the psychotic symptoms are much more prominent. Um, I also have other issues like depression and anxiety, uh, which are a whole nother issue altogether. I guess anyone can suffer from severe depression or anxiety, whether they're psychotic or not, whether they have bipolar disorder or not, whether they have schizophrenia or not, whether they're schizoaffective or not. Um, I don't think I've ever had a psychiatrist tell me that I've had a specific anxiety disorder. Um, Although I do take medications for anxiety, I take Klonopin, which you have to be careful with because it is physically addictive. But I also take Neurontin for anxiety. A lot of people don't know that Neurontin, also known as gabapentin, can be used off-label as a way of treating anxiety disorder. Um, I used to take an antihistamine known as hydroxyzine for anxiety. It's similar to Benadryl, and it's not real effective for treating anxiety. It's a very weak drug. It really doesn't do much. So my psychiatrist stopped it. I think it was last year. It just really was a waste of time and money to take it because it's not really that effective for severe anxiety, which I have. Um, Klonopin is temporarily effective for anxiety, but the problem is it's physically addictive. If you take it in too high a dose for too long a time, you're going to have a real hard time getting off of it without physical withdrawal symptoms. It might even be life threatening. So my psychiatrist limits my use of Klonopin or any benzodiazepine pretty strictly. In my case, I take Klonopin. I take 0.5 milligrams, that's half a milligram, no more than half a milligram every day. I know people who take 2, 3, 4 milligrams of Klonopin a day, and their doctor happily prescribes it that way. But that's actually very dangerous because I know people who've been on Klonopin for years and they can't ever get off of it because they might actually die from it, from the withdrawal from it. Klonopin and benzodiazepines in general can be very dangerous. Um, Ativan, Klonopin, Valium, Xanax, and Librium, and a bunch of other similar drugs. They're all called benzodiazepines. They're effective for not schizophrenia, anxiety, but they should be used very, very carefully, and certainly not in high dosages, and certainly not over long periods of time. Um, I'm seeing my psychiatrist tomorrow. I suspect one of the things we're going to talk about is my Klonopin use. I personally don't think that this is the time for me to go off Klonopin. I'm not taking a very high dose, and I don't take it every day. Um, I'm still under a lot of stress. I recently had 2 surgeries. I've had a lot of medical issues. I've been socially isolated like everybody else because of COVID-19 lockdowns, and I have some other personal stresses going on. So I will be discussing all this and my Klonopin use with my psychiatrist tomorrow. Um, for those of you who don't know, today is Wednesday. Monday morning, I went to the psychiatric emergency room, which I already described in a video on Monday that I did. If you want to know the details, you can watch that video of why I went to the psychiatric emergency room and how they discharged me the same day and what they did for me while I was there and how I got there. But I just wanted to clarify what schizoaffective disorder is and how it's related to schizophrenia and why I call myself a schizophrenic when I do these videos, as opposed to calling myself schizoaffective disorder. Psychiatry is partly science and it's partly art. A lot of it could be considered to be educated estimates. I wouldn't use the word guess, but a psychiatrist sometimes has to use their own personal judgment and experience on diagnosing somebody and what their disorder is. Um, I was originally considered to be just bipolar at one point, but that excluded the fact that I was also hallucinating and having delusions um, and psychosis. And so the bipolar disorder diagnosis for me was never really accurate and never should have been made, at least not by itself separate from schizoaffective disorder. Um, the medications I take for schizoaffective disorder are, like I said before, Seroquel, which is an antipsychotic, but it can also act as a mood stabilizer. Zyprexa, which is an antipsychotic, that I use for my hallucinations and my delusions. Um, Klonopin is for anxiety. I'm not on any antidepressants right now. Depression for me doesn't seem to be something as severe as the psychosis and the mood swings of bipolar disorder. Um, an antidepressant might actually be counterproductive in schizoaffective disorder because it can cause states of euphoria and make a manic state worse in schizoaffective disorder or bipolar disorder. So I'm not on an antidepressant right now. I'm on several medical medications, one for high blood pressure. Um, Bojack Horseman is asking me, do I have schizophrenia? As I Hello, Bojack. I just wanted to answer your question. Do I have schizophrenia? As I was just explaining, I have schizoaffective disorder, which is a form of schizophrenia. So to answer your question, I do have schizophrenia, and I'm doing okay. Uh, so let me know that you just got my answer to your question in the chat. Um, but as I was explaining, um, schizoaffective disorder falls into the schizophrenia spectrum as defined by the American Psychiatric Association. Um, Hold on, I just want to answer him right now. Um, and I'm just typing something here. I'm live here, so I'm doing this on the fly. I take several medications for the fact that they come with anxiety. Zofran, it's not a psychiatric drug, it's for nausea and vomiting. I take blood pressure medication, like I said, I take sleep medication. I take Tylenol for headaches. One or two other medical drugs to take for stomach. I have a long history of stomach and intestinal issues, um, and I take medication for an enlarged prostate. Although I may not need that medication for much longer because I had prostate surgery, and taking a medication for a prostate that's been mostly removed may not be necessary. But that's something I'm going to have to ask my primary physician and not my psychiatrist. Um, when I had surgery a couple of weeks ago on my bladder, I was taking a painkiller. They gave me Oxycontin. They gave me 8 tablets. But believe me, you don't want to take Oxycontin at all if you can avoid it. And you sure as hell don't want to take it for more than 2 or 3 days. Otherwise, you'll become fucking addicted to this shit. I mean, there's an opioid crisis going on in this country. And tens of thousands of people are dying every year from overdoses from opioid drugs, a lot of them prescriptions. Some of them street drugs like heroin and fentanyl in the heroin, but a lot of it's from prescription opioid drugs like Oxycontin and fentanyl and other prescription drugs. Um, I take Tylenol for pain, and I pretty much restrict it to that. I can't take, I can't even take aspirin because I have a history of stomach bleeding. I took aspirin for years, and one day my stomach just gave out completely, and I just started vomiting blood. It just started pouring out of my mouth, and they had to give me blood transfusions. And I'm not even sure how they stopped the bleeding in my stomach. They didn't perform surgery. I'm not sure what they did. I don't know if they put something down my throat into my stomach to stop the bleeding or what they did. All I remember is that I was vomiting up a lot of blood. I passed out and I woke up in the hospital, and they had somehow stopped the bleeding in my stomach. And they warned me never, ever, ever to take aspirin or blood thinners ever again. Um, so, um, even over the counter drugs can be dangerous if you take too many of them. That includes aspirin, Tylenol, or whatever. Um, and I think some people with psychosis think that if they take more of a drug, that's a good thing, that if Tylenol controls pain, well, I'll take even more Tylenol. Or if aspirin controls pain, I'll take even more aspirin. And